All right, it looks like people are slowly coming in, but we'll go ahead and start with introductions. My name is Megan Donnelly. I'm the Director of Health Communications at the Celiac Disease Foundation, and I'm also a registered dietitian. I'm joined today by a wonderful group of experts in this topic. We have Dorit Karen, who is a parent of a child with celiac disease and will be providing a parent's perspective on managing celiac disease in schools. She also happens to be an endocrinologist, but that's not why she's here today. After that, we will have a presentation by Vanessa Weisbrod, our Chief of Education and Community Engagement at the Celiac Disease Foundation, as well as Dr. Non Du, who's a gastroenterologist at Boston Children's Hospital. They will talk about the barriers that students face in school and how to overcome some of these barriers. And then I will close it out with just a short presentation on the nutrition components of school meals. So let's start with our conversation with Dorit. So, Dorit, thank you so much for being here today. If you just want to quickly introduce yourself and your relationship to celiac disease to get us started.
Sure. Hi, everybody. Thank you so much for inviting me. It's such a pleasure to be here. My introduction to celiac disease was, I would say, two stages. The first stage was in my professional life as a pediatric endocrinologist, where celiac disease was present in a variety of ways, whether it be from screening kids with diabetes, type 1 diabetes, or with thyroid disease, or the kids with short stature who we'd screen and then refer as necessary. And so I thought I knew something about it. And then my daughter was diagnosed a year and a half ago, and I started learning a whole lot more about just how complicated this disease is and how challenging and frustrating it can be to manage it.
Yeah. So I want to hear more about that. What does a typical day look like for your daughter when it comes to meals and snacks? Does she bring food from home? Does she eat in the cafeteria? Is it a mix of both?
So the way that it looks now is a little bit different from the way that it looks in the beginning when we were really very nervous and we sent her with food every day. Um, Now it's in the school context. She starts off eating breakfast at home, variably depending on how on time we are or not. And then, if time permits and she gets to school, she might have a second breakfast, as she likes to call it, with loving reference to Lord of the Rings and the Hobbits. There is a snack which all the kids bring from home, so she does too. And we try to, throw in a fruit, maybe a vegetable, and her favorite gluten-free Oreos, of course. Um, and then there is a school lunch, which she usually eats. And then after that, there's, the after-school snack and dinner and such.
Mm. Great. So, has your daughter's school been supportive in providing gluten-free meals? And what have been your best experiences and some of your most challenging experiences?
I think some of the bigger challenges that were in the beginning, when we actually did not realize that the school offered a gluten-free option. My daughter was diagnosed over the summer, and so I went and looked at this lunch menu and online, and I didn't see anything that was gluten-free. And I said, okay. And I tried to get more information, but of course it was the summer, and everybody said, we'll get back to you once the school year starts, and that's understandable. So, okay, we sent her with a cold lunch every day, and she was heartily sick of it. And then actually met Vanessa, whose child is in the same school as my kids, and she said, "Oh, didn't you know they have gluten-free menu?" I did not. So that was that big normalizing factor for my daughter just being able to get school lunch like everybody else. So in the beginning, we got the instructions of you have to provide us with your meal choices in advance at the beginning of the month, and we tried, and that's really difficult with my little picky eater who doesn't necessarily know what she's going to want to eat from day to day. But thankfully, the dietitian at the school said, or the no, not dietitian, pardon me, the head of the school meal program said, "It's okay. You don't need to do that. We have enough gluten-free options on a regular basis." So that's a big relief because then she gets to think about it and make her choice every day, and that's really important for her and feeling some sort of control. Now, the options are variable. And even if there is a gluten-free option, that doesn't mean she will eat it, but at least there's something that she can eat, and that's already a big difference there, right? But sometimes a school option might be very nutritious, and sometimes it might be, well, sorry, today the option is Lucky Charms. And she may be delighted with that, but I'm perhaps a bit less delighted. So that's the everyday. In terms of the biggest challenges, that would be the two times that she was accidentally exposed to gluten. Once was during second breakfast when she was given a gluten-containing fig bar, and the other one was during Passover last year when they really thoughtfully provided her with a matzah, which alas was not gluten-free. And so she described how the school nurse came running to the classroom to drag her to the office and watch her. And luckily for her, she doesn't have really violent physical manifestations, but it still was not a very pleasant day.
Yeah, I can imagine. And you mentioned normalizing, and I think getting exposed to gluten is sort of along the same theme. I mean, does your daughter ever feel socially isolated during school or food-based activities related to school? Does she experience any changes in her social life?
A little bit. So I asked her about this yesterday, actually, in preparations, and what are some of the things that she finds good and what are some of the things that she finds annoying. So, for example, when they have cookies, there isn't necessarily a gluten-free option. So she gets Italian ice, which she's generally happy about, but then sometimes kids get jealous, and then sometimes it's too cold and she doesn't want Italian ice, and she would really just love to have a cookie like everybody else. In terms of school-based activities, they provided some nice alternatives. Last year that to I'm trying to remember what it was. I think it was the paper mache that was the issue there. She hasn't had any flour-based activities since kindergarten, and that was before she was diagnosed. But I do know that the school offers nice alternatives to flour-based activities that the entire class will use gluten-free flour, which is really quite lovely and thoughtful, although that may change the physical properties of materials. So my daughter is planning ahead to fifth grade when she knows this unit will be because she has a fifth grade brother, and she already wants to bring in different kinds of gluten-free flours and compare their physical properties.
Oh, wow. I love that. Good for her. So do you have a 504 plan in place at your school? And how did that process go?
Um, yes, we do. And this year smoothly, and last year less so. So she was again diagnosed in the summer a year and a half ago between kindergarten and first grade. And okay, given my previous background, working with kids with type 1 diabetes, where reaching out to the school nurse and getting a 504 plan is just one of the first things that you do. I didn't think twice about it. And I went ahead and I reached out and said, let's set up a 504 plan for whatever it is. And that took until mid-October to set up because it just happened to be that the school nurse was new, and this was her first 504 plan that she'd ever worked on. So it took her some time to sort of work through some of the kinks. But it is helpful to have just in knowing that there can be accommodations, that it's all written down and I can point to it if there's a problem. And also in ensuring that she has free access to liquids and she can go to the bathroom whenever she needs, which we find very important. I did not actually realize that not everybody has a 504 plan until I happened to talk to another family who happens to have celiac disease who was going through the same school district. And they said, oh, no, we've never had a 504 plan. Our kid just brings food from home every day. Okay, different strokes for different folks.
Yeah, certainly. So in conclusion, I'd like to ask you if you could change anything in your daughter's school or the system as a whole. What do you think would make it easier for kids with celiac disease to feel included and safe at school?
You know, so I'll start with the school district actually does a pretty decent job, except for those, you know, those few lovely exceptions of getting gluten exposed, which is not ideal. I don't know. I have to take it as an article of faith that the cross-contamination is minimized to the best that they can. I don't think it's possible to completely minimize that, so I wouldn't ask for the impossible. It is left to the kids a lot to still advocate for themselves, and that's not always so easy. So that no matter what, you always have to explain. And my daughter has to explain to her classmates why she has the pizza box that and when she's supposed to only get one slice, and why she gets a separate special container at early release days with her name on it, and why she can't do some things. So just a little bit more help for the Shire kids, because not everybody feels comfortable advocating for themselves. And then as a parent, I would love for the first of all, for the gluten-free options to be more widely publicized, so that because not everybody's lucky enough to have somebody like Vanessa with a kid in their grade, never mind in their school, right? To say that, for there to be more flexibility. So the flexibility that our school provides is nice, but I worry about going up to middle school and high school if she's going to need to provide all of her choices in advance every day. That's does not leave room for flexibility, and that's rough. And I would love for there to be reasonable, healthy, gluten-free options every day, because while she might be delighted with the Lucky Charms option, my pediatric endocrinologist heart says, you know, that's not the most rounded meal possible. But honestly, I can't complain. There's wrinkles, there always are, but the school district really has done a very good job, and my daughter hasn't felt excluded, and she's been able to have a pretty normal school existence, and that's already a lot.
Mhm. Well, thank you so much for sharing these experiences. We really appreciate all of your inputs and your advice. Just for everyone on the webinar, if you have questions for any of the speakers, please put them in the Q&A and we'll do our best to address them at the end of the presentation. And with that, I will turn it over to Vanessa and Dr. Du.
Thanks, Megan. And thank you so much, Dory, for being willing to share your story. I feel honored that I was able to play a small role in helping your family get connected, but your story and the path to getting to the gluten-free accommodations shouldn't come from a neighbor or a friend. We ultimately want to make sure that these things are coming from the school. And so this is exactly why we're here today, to talk about the barriers that families face in getting proper accommodations at school. So I'm going to start this off by talking a little bit about background on celiac at school, and then turn it over to Dr. Du to talk about the research. And then we'll finish up with more information about overcoming barriers and some nutrition lessons. So to get started, we know that celiac disease affects about 1% of children in the United States, most of whom attend federally or state-supported schools. And we know that celiac impacts their health, their families, and their overall educational experience. This year, there are about 49.4 million children enrolled in US schools, and if about 1% of them have celiac disease, that's about 500,000 students who require strict gluten-free accommodations at school every single day. Strict gluten-free diets are essential for celiac disease, but the meals and food they get at school and the activities that they engage in, both in the classroom and in extracurricular and other school-sponsored activities, can pose lots of challenge. Having the right education in your school and the right accommodations are truly key to having a safe and inclusive experience at school. So, sticking to the gluten-free diet can be tough for kids, especially during meal times with their peers. That's when they're tempted to cheat or to try what's on their friend's lunch tray. We know that they can come into contact with gluten in the cafeteria during class celebrations, with school materials like Play-Doh, art supplies, or paper mache like Dorit spoke about. We also know there's lots of risk for cross-contact. We also know that kids with celiac disease can be excluded from activities, which can impact their adherence and well-being. And we all know that non-adherence to the gluten-free diet can lead to serious health consequences. There are also social emotional considerations for celiac disease. Sometimes kids at school can attract negative attention from their peers because they're eating different foods, they're asking questions, or they're having symptoms from celiac disease. We also know that some students don't have any visible symptoms and may have what we call silent celiac disease, and they can be judged by peers who, or teachers or other parents who doubt the validity of their diagnosis and may not take it seriously. And we know that students can experience teasing, taunting, harassment, and bullying, not only by other kids at school, but by teachers, coaches, and other adults. But what we also know is that with education, planning, and the right accommodation plan, we can significantly improve the experience of a student with celiac disease at school. And so we're going to talk more about that. So there are laws that govern celiac disease, federal laws. There are 4 of them that we're going to talk about today. The first is the Americans with Disabilities Act. Celiac disease is recognized as a disability under the Americans with Disabilities Act because it substantially limits one or more major life activities. The most simple of them, eating and digestion, though we know that celiac disease affects people differently and may affect any system of the body. Any school that receives federal funds is required by law to provide reasonable accommodations for kids with celiac disease. If schools are not accommodating, this can be considered discrimination, and you can file a complaint with the Office of Civil Rights if your school does not comply. However, I have been working with schools and pediatric hospitals for almost 20 years, and I have been in thousands of 504 meetings with kids, and only one time has it ever gotten to a place where we had to file a complaint with the Office for Civil Rights. In all cases, we were able to work with the family and with the school to get the right accommodation in place and to work for both. Section 504 of the Rehabilitation Act is a civil rights law that protects students who have a disability, including celiac disease, in any institution that receives federal funding. Because celiac disease is considered a disability, a child with celiac disease should have a 504 plan that documents all of the required accommodations for them to be included and have equal access to all of the educational opportunities as well as programs offered in the school. There are lots of accommodations that can be included. A few to name examples are safe gluten-free meals in the cafeteria, prevention of cross-contact in classrooms and activities, permission to carry and eat safe snacks as they are needed, and training for the staff on celiac disease. What's really important about Section 504 is that it does require reasonable modifications. So, for example, Dorit couldn't go to her school and say, I want the whole school to be gluten-free because my daughter has celiac disease. These have to be reasonable modifications to any of the policies, practices, and procedures to make sure that the child with celiac disease is included and has access to everything. So there are different types of plans that schools can offer. The 504 plan, as we've already talked about, is the most appropriate for celiac disease. And it's the one that we want to see for celiac disease unless your child has another condition that would qualify them for an individualized education plan. An IEP is only for students who have a coexisting learning disability that qualifies under the IDEA Act. If your child does have one of these learning disabilities, celiac disease can also be written into the IEP for accommodations, and it is as legally protective as the 504 plan. What we don't want to see is just an individualized healthcare plan. The IHP is a medical management plan that is developed for the school nurse, and it outlines specific health needs and emergency care. It is not legally enforceable. However, it could be used alongside a 504 plan. So, for example, if your child has celiac disease and they have a very severe reaction, my son is 11, he has celiac disease, and pretty quickly after ingesting gluten, he starts vomiting pretty severely. And so an IHP could be written in conjunction with his 504 plan that would explain how a physician would want him to be treated for the nausea that's happening if he's vomiting. For example, giving him Zofran or other measures to help him feel better when he is having a gluten reaction at school. Another example is if your child has an EpiPen for a food allergy that would lead to anaphylaxis. The details for how to administer the EpiPen would be documented in the health plan. But again, this would be an addendum to the 504 plan, not a standalone document. And really the reason for that is the enforceability of it. If something goes wrong with the 504 plan, the school is required to accommodate and required to make the necessary changes, whereas with the IHP, they are not. So here are some more examples of reasonable accommodations. Providing safe gluten-free meals, preventing cross-contact in food preparation, storage, and serving, sharing meal menus with families in advance and notifying them of changes. In the classroom, making sure that there are gluten-free alternatives available for celebration, cooking classes, and food-based activities. When I say food-based activities, I want you all to remember this because it's something that comes up quite often. Sometimes schools will say that they're a food-free environment, but then Play-Doh comes into the classroom, and we know that Play-Doh is made from wheat flour. Play-Doh is not considered a food-based material, yet it's made from a food that is not gluten-free. And so even if your school tells you that they're a food-free environment, it's important to look at what materials are being used in the classroom so that you make sure that your child is not being exposed to gluten. Paper mache, as Dorit said, is a great example. Again, not considered a food-based activity, but it is made from a food item. We also want to see good cleaning practices. We have lots of good data showing us that cleaning works to remove gluten from surfaces, and so we want to see good cleaning practices. Inclusion is a really big deal for kids with celiac disease, and we want to make sure that they have the right accommodations to always be included. We want to see hand washing across the board. Hand washing is good for everybody, regardless of celiac disease, and so that's really important. We want teachers and staff to understand what celiac disease is and how to accommodate the gluten-free diet. And we want to make sure that your student is participating in activities without restriction or exclusion. So Dorit talked about using paper mache in the classroom, and this is one where we tend to see kids with celiac disease excluded. I've had many cases where a student with celiac disease was asked to leave the classroom when they're making paper mache volcanoes in science class. And they were sent to the library to watch a video or read a book about volcanoes instead of the hands-on learning activity that was happening in the classroom. We don't want to see this happen. Your child being taken out of the classroom is excluding them from a peer-based learning style, as well as missing out on the hands-on learning that they're doing in the classroom. And so we want to make sure that that doesn't happen and that they have access to the same type of learning that all the students do. Um, there's also the National School Lunch Act and the Child Nutrition Act, which ensure safe meals. So these laws actually require that schools provide meals to all students, including those with medical dietary needs, so those with celiac disease, as long as you have a letter from a licensed healthcare provider stating that they need to have a gluten-free diet. They are required by law to provide a gluten-free meal, and they cannot charge you more. So if you pay for lunch at school, they cannot charge you an additional cost for the gluten-free meal. Or if you live in a state with universal school meals, there are 8 states now, they cannot charge you anything for the gluten-free meal. So if you live in California, Maine, Colorado, Minnesota, New Mexico, Vermont, Michigan, or Massachusetts, you should be able to get free breakfast and lunch gluten-free at school. If you're not, let us know and we can help you with that. But the big question, is everyone with celiac disease eating breakfast and lunch at school? Nope. And that's why we have Dr. Du here to tell us what the research is showing. So Nan, I will turn it to you.
Perfect. Thank you so much, Vanessa. And so I'm just going to spend the next few minutes reviewing a study we did looking at actually parental perceptions for children with celiac disease in Massachusetts, on barriers to accessing gluten-free school lunches and breakfast. So the objective of the study was one, to just try and figure out how many families with a child with celiac disease, the Massachusetts public school system actually used free school lunches and breakfast. And then to also ask them what were the barriers to be able to accept the usage of this free school lunch, and then also to see what their perceptions of the nutritional quality of gluten-free school meals are. As I think you've started to hear this theme of feeling like maybe gluten-free meals are not as nutritious. So trying to see if that truly was a barrier that many parents perceived. And how we did this was we did an electronic survey through Celiac Kids Connection, which is a group partnered with Boston Children's, a compilation of parents and families who have been diagnosed with celiac disease. So it's a pretty active list of those with celiac disease in Massachusetts. And we asked kind of about food insecurity, gluten-free food insecurity, nutritional quality, and communication about gluten-free diet in schools. Next slide, please. This is just briefly kind of telling you the numbers. We started with about 285. 196 didn't reply to the survey, 89 completed the consent, leaving us with about 75 who actually correctly met all the criteria, which was kids between the ages of 5 and 11. And I did want to just note, we focused on this group because we know that parental perceptions can play more of a role in elementary school kids versus those who may be in high school. So that's why we focused on that. So this is just a brief kind of just demographics of it, showing that 93% own their home. It was like those who had a good household income of at least 100,000, at least were well educated. Many of them had been on the gluten-free diet for greater than 2 years. So it was families who were comfortable with the gluten-free diet. We weren't just looking at those who had just been diagnosed and who were really hesitant. And we thought this was important because this is where we would be able to capture kind of general themes of how about like school lunches and kind of how that's been throughout their time with the diagnosis of celiac disease. And then the general age just shown is there just to confirm that yes, we focus between 5 and 11. Next slide, please. In terms of perceived gluten-free options at school, as you know, we've mentioned already about the 504 IEP plan, and we found that actually 17% didn't have one. And I think, as Vanessa has already mentioned, this can be really valuable. And also, I know Dorit had mentioned it, and letting the school know that you have this diagnosis to make sure they are able to put these supports in place and to be well informed. And then 48% actually felt that their school never offered gluten-free options for school breakfast, and 28% felt their school rarely or never offered gluten-free options for school lunch. Next slide, please. This was another key finding of our study where 40.3% said that the school doesn't communicate about gluten-free options at all. That was really startling to us. And then when we kind of dived in a little bit deeper on those who did ask, it was kind of a mix between text, a phone call, some email, a school webpage, and then some even used paper. So there wasn't a consistent way of communicating, and it seems like there was a range. And some of those may perhaps be not as informative or not as easy to get kind of quick, real-time information about the diet at the school. And as you can imagine, 61.3% were quite dissatisfied about the school communication about the gluten-free options. Next slide, please. And so it's not surprising in which we found that 85.3% actually had never consumed free school breakfast and 45.3% never consumed free school lunch. And this is just to emphasize, this is in a state where lunch and breakfast are completely free. It's not kind of income based at all. But they were saying that they've never consumed. Next slide. And kind of diving in deeper as to why. So 82.4% said, oh, they choose to eat it because their friends eat it. So it's kind of knocking, as Vanessa brought up before, like that being, if other people are doing it, it may make it easier for those to be more willing to try it. It's convenient, they save money, or other reasons why they would participate. Next slide. But I think this is where it got kind of interesting as the most common reasons why you didn't participate in school lunch breakfast by families. One is a common theme, as has been come up for is they just don't like what's being served for school lunch and breakfast. But I think what we thought was concerning is I'm not confident that the school cafeteria could make a safe gluten-free meal for my child. And that was for 51.5% of those who were not who did not choose to participate in school lunch breakfast or choose to do less. Some other reasons is they feel like it could be healthier, there's more variety and choice, and they have a little bit more control about what they're doing. Next slide. And I think the reason why this is important is that in those who were food insecure, actually 50% were not actually consuming the preschool lunch and breakfast. And that was just really a lost opportunity because this is an area where they could be getting food and access to that. And potentially that could help relieve the household budget as well. And they weren't able to take advantage of it or didn't feel comfortable to be able to use that resource. When we screen for both food insecurity and gluten-free food insecurity, the difference between the two is we specified specifically looking at gluten-free foods as well for their food insecurity level. Next slide, please. And so this is kind of diving a little bit deeper in terms of, again, 45.3% were very concerned or somewhat concerned about gluten cross-contamination in the school's cafeteria. And actually 16% had a unintentional gluten ingestion of the school lunch breakfast. And I know we've talked about how um, it's not a perfect world. It can be hard to totally go without a gluten ingestion. But it was remarkable that in our small subset, we did have that percentage. And there was quite a few who said it's like not an appealing food. There's really limited variety. And they really just had little trust that the school could prevent this gluten cross contamination. Next. And then I did want to touch upon the nutritional qualities. I think in general, even if you look at kids who are not on a gluten-free diet, there's been questions about school lunch and their nutritional quality. But I think it's still a big concern for gluten-free foods, as you guys brought up, like Lucky Charms. Like, yes, it's gluten-free, but is that really kind of covering all the kind of protein, carbohydrates that we'd like them to kind of get at school? And then we also asked specifically about gluten-free carbohydrates, fruits, and protein-rich foods, and found that it might be less easy for proteins, but it's otherwise pretty easy to find fruits in the cafeteria. Next slide, please. So really kind of just to summarize those findings, as I realized there was a lot of numbers that we brought up, was that kind of we broke it down to kind of four big barriers and also areas of opportunity as well. So one is there's really poor communication by school about gluten-free options, whether it be the method they're doing it or even just communicating itself. It just the parents are not receiving it or perceiving they're not receiving it. There's really a limited variety of gluten-free foods offered in schools. That was a persistent theme. There's low trust in the prevention of gluten cross-contamination. And I think there's also a concern for overall nutritional quality. And I do want to stress nutritional quality and limited variety are two different concepts. And so that's why they're in two different barriers, because you could improve the variety of gluten-free foods, but they could still not be nutritionally high. And so that's why we made those two different barriers. Next slide. And then I did just also want to add this point because I think in terms of, we know that gluten-free products can be impacted by the supply chain. This was especially relevant, I think, during the COVID pandemic as well. But 24% said the school's ability to provide gluten-free food was affected by supply chain issues, which we were actually pretty impressed with that number. But 36% were still dissatisfied about the school's communication regarding changes to gluten-free options. So this is just another thing for schools and parents to be aware of, like how do you respond to changes, understanding that certain gluten-free foods may have shortages or otherwise. Next slide, please. So just to kind of conclude, we did this study really, I think, to try and find opportunities. One, identify the barriers, perceived barriers for parents, and then try and then address those. So there's really an opportunity for education in the school system about providing gluten-free school lunch and breakfast, whether it's through our school nurses, the cafeteria staff, and really just updating school web pages and communication. There's an opportunity from a provider standpoint to ask about the family's use of the school lunch breakfast in terms of like a 5-0 plan reinforcement. Like this is a great way to make sure all parties, parents, providers, and schools are all aware of the celiac diagnosis and to make sure those supports are in place. And then finally, as we mentioned briefly, those who are food insecure, this is really a great opportunity to make sure that those kids are able to get safe gluten-free food and to help maybe with their household resources as well by taking maybe one meal off the kind of the budget. I'm going to turn it back to Vanessa, but I think I've set her up with kind of a list of the barriers we identified, and now she's going to move towards what we can actually do to help.
Yeah, thank you, Dr. Du. That was so wonderful. And it was such an honor to be involved in the research that you did looking at this. And what we're doing now is really phase 2 of what we started with the research is doing the education and looking at how we overcome all these barriers for parents and for school districts. So I'm going to pause for just 1 second and let you, if you'd like to take a screenshot of this slide, we will also post this online with the recording from today's webinar and have it sent out on email as well. But this is really the table that we put together of ways to overcome barriers. And I'm going to talk through all of these in a lot of detail. Now, these the overcoming the barriers, this is written in language that that we're hoping is helpful to your school cafeterias and your school districts. And Dr. Du and I are actually doing this exact training on May 21st in person at the Healthy Kids Healthy Programs Summit in Massachusetts, which is a 2-day summit where schools from all across the state of Massachusetts come together for their annual learning on providing food and healthy options and programs to kids in schools. And so we're using the same wording because we want families to see what we're teaching schools so that everybody is on the same page with the same expectations for what to expect and what to ask for. We also think that these are really great suggestions for things that you can ask your schools to do now. We're doing this in Massachusetts, but we are working actively with other states. And if your state is interested, we are more than happy to share resources and educate in as many places as are willing to listen. So we are going to start by talking about poor communication by the school about gluten-free options. And so some suggestions for overcoming this is so simple. Create a gluten-free email list to regularly update parents on food options. By simply sending an email to all families at the beginning of the school year explaining the gluten-free process and regularly updating them of any changes can completely change the experience. If Dorit had received an email at the time that her daughter's 504 plan had gone into place, she immediately would have been able to start her on getting gluten-free breakfast and lunch at school at the time of diagnosis, as opposed to it being months and months later that she, learned from a friend that her daughter could do this. Also, asking the schools to post a page on the nutrition website with gluten-free menu options that's easily located. Having the gluten-free menu options available and accessible to families can go such a long way. When Dory was wondering, can my daughter eat at school? She couldn't find anything, and it was very challenging to get the information. And so we asked schools to not hide the information and to make it in a place that parents are likely to visit. Most parents who have kids that eat at school visit a web page regularly to get the monthly menu option to see what's being served. And so if you can simply put that information there, it will make everyone's life so much easier. Sharing brand names with parents for the gluten-free products and being open to suggestions for better options. So this goes in a lot of different directions. So I'm a parent of a child with celiac disease, and I know that knowing on a regular basis what he is being served at school helps me not be anxious about allowing him to eat at school. So I know the brand of the pizza crust they're using. I know the brand of the bread that they use. I know the brand of the gluten-free pasta that they use at his school. And so I feel more confident that he's getting the right gluten-free meals. The other piece of this is that we want schools to be open to hearing from parents and having suggestions. So this actually happened to us 3 years ago when my son was in second grade. They started doing 1 day a week where they had breakfast for lunch, and all of the other kids could choose from pancakes or waffles with eggs and other fruits that came with it. And my son was always given gluten-free toast. And, for kids, the idea of pancakes and waffles are much more exciting than a piece of toast. And so he really wanted to be able to have this. And so I called our head of food services and I just said, would it be possible for us to see if there is a gluten-free option? And if not, could I bring in gluten-free waffles or pancakes for you to keep in the freezer for him to have on these days? And the head of food services called me back an hour later and she said, I am so sorry. I never even looked to see if we could get gluten-free pancakes or waffles. And it turned out that they could get both. And it turns out that the pancakes and waffles are gluten-free, dairy-free, and nut-free. And so now kids with multiple food sensitivities are all able to have waffles or pancakes on the breakfast for lunch day. And it was a very simple, conversation with no pushback because it was on their normal ordering list. So if you haven't done this with your schools, I would absolutely encourage you to have these conversations and to see what is possible because they may just not have looked. It's not that they don't want to offer the gluten-free option, it's just that it may not have crossed their minds to do so. So this is an example website. This is from Arlington, Massachusetts, of how they are promoting their gluten-free menus. So as you can see on this website, this is the regular page. This is the food services page of the school district's website. The March elementary menu, the gluten-free elementary menu right beneath it. So you're not digging for a special gluten-free page on the website. You see the middle school menu and then the gluten-free middle school menu right below it. Makes it very easy to locate that information. This is an example email from Needham, Massachusetts, and this goes out to families the second that you are diagnosed with celiac disease and you need a gluten-free diet at school. And what's great about it is that it tells you what the options are. It tells you how to get the information with the links, and it just makes it so easy right away to get the information. Again, we're happy to share examples that you could share with your schools as well, for them to just, plug in the information that's relevant to your district. So limited variety of gluten-free foods offered. So again, as I just talked about, reviewing foods that are part of the normal ordering catalog to see what can be brought in. There's a lot that school food service providers have to think about, and a lot of ordering that has to happen, and a lot of requirements for meeting the right price points, as well as nutritional requirements in the foods that are brought in. And so what they don't often think about is the extra products for the special diets. And so truly forming a relationship with your food service provider, the head of nutrition services, the dietitian for your district, the person who does this ordering, is something that is so important. I know that we're all very busy parents, but just making a little bit of extra time in the day to get to know this person can really help. I would also be a strong advocate of adding them to your holiday card list, and, Teacher Appreciation Week, including a card for them just to express your thanks and appreciation for them having gluten-free options in the cafeteria. I make sure to do this every single time, and it has really been helpful in building that relationship. Having a gluten-free menu. There are lots of kids with celiac disease across the country, and gluten-free menus will be used by lots of people in every school district. And so we really encourage schools to put together a gluten-free menu so that you aren't having to search through complicated apps to determine what pieces of which meal are safe for the day. So creating a menu is really helpful. And then identifying meals that can be made naturally gluten-free for the entire school. So we've worked with lots of school districts between the Celiac Disease Foundation and Boston Children's Hospital in looking for naturally gluten-free items, things like corn tortillas for tacos, replacing soy sauce with tamari or gluten-free soy sauces. There are lots of gluten-free meatball options now that are available to school cafeterias on their normal ordering list, and lots of schools have just replaced the gluten-containing meatballs with gluten-free meatballs for everybody so that there is, one, no risk for cross-contact, but also it's just easier to have everything be the same. So here is an example of a gluten-free lunch menu. And so if you look at this menu, you can see that they're pointing out not only, you can see they have gluten-free chicken tenders, they're using an Udi's gluten-free dinner roll, and then they're serving it with green peas and fresh apples. And so they really are pointing out what is available, meeting all of those nutritional requirements that they have to meet. You can also see on the side that there are daily alternatives. So if your child does not like what the main meal is, all of these on the side are what they can substitute with on any given day as a choice option. This school district has done a tremendously good job of putting this menu together, but they are not alone. There are lots of school districts that are doing this very well, and that you can use their example materials to work with your school district too. So low trust in preventing cross contact. So this is something that is really concerning to all of us. I am a parent to a child with celiac disease, and I have celiac myself, and this worries me every single day. But what helps me is that my son's school does have a webpage that explains how they handle food safety, specifically in relation to celiac disease and the gluten-free diet. And just knowing that this is part of their normal operating procedures helps me feel more confident in my son eating at school. Also having a monthly email update to families with kids with celiac disease if there have been changes in process. It is no fun to be a parent and to get, to find out something has dramatically changed when your child comes home from school after you can have done something about it or have asked the right questions. And so we really encourage schools to be transparent and to be regular communicators so that parents can continue to feel confident in their child eating at school. Also, we want schools to be transparent. Most schools are actually doing a really good job of preventing cross contact, and they should share that information and be transparent about their practices, because if they were upfront, all of us here today would feel better about our kids eating celiac disease at school. And again, here's just an example of another school that how they have put out their practices. So they start by stating how they understand gluten-free meals to be, and then they outline how their normal operating procedures in the cafeteria work when handling gluten-free foods. These are all very simple things. These are things that are done every single day and exactly what I would expect of my child's cafeteria to keep him safe. And finally, the nutritional quality of gluten-free foods. So there are laws, all of the School Lunch Act, the breakfast laws, they all require schools to meet certain nutritional requirements and certain food groups. And as you saw in that menu, that gluten-free menu that I put up was telling parents how they are meeting those metrics. And so by simply sharing this information with you, hopefully you will feel better about it. Other ways that schools can do this is sharing photos of the meals, either on social media or in emails, so that you can see what foods are being served. And again, by sharing the brand names of the gluten-free products can also allow you to do some of your own research. The other thing that we've seen as being really successful, especially during COVID when there were supply chain issues, schools could not get their normal gluten-free breads. They couldn't get their normal pizza crust. And so lots of schools held tasting days for all the kids with celiac disease to come in and can taste the options that they could get. And this was a really fun way to engage kids in the process of selecting foods, but also an opportunity for kids to meet other kids who have celiac disease that they may not have known did before then. So just another fun way. Um, these are some photos. These are from the Needham, Massachusetts School District. This is their Facebook page, and they regularly, not every day, but several times a week, they actually post photos of what they're serving in the school cafeterias. And I love getting these alerts on my phone and just seeing what my kids are having access to at school. And I think that if more schools did this and shared it on their community's Facebook pages or whatever the channels are that your community uses, it would really go a long way in helping families see a little bit inside of the schools and what our kids are getting. And I can say to my kids when they come home from school, "Oh my gosh, I saw you guys got a new fruit bar at school today. Like, did you get oranges or strawberries?" And it's a good conversation starter to also talk to our kids about what they're taking off the lunch line. So just to wrap up, there are national guidelines that exist for managing celiac disease at school. These came out of a national collaborative of 12 pediatric hospitals, national education associations, public and private schools, nurses, teachers, parents, and students. These were published in 2020, and they are available in English and Spanish with the QR code. So if you haven't already seen these, I would absolutely recommend downloading them and having a copy handy. There are also lots of resources available. Everything that I talked about today, all of those resources are available on the Celiac Disease Foundation website. You can get them by scanning the QR code, and I'll also ask Emma or Megan to drop the link directly to that page in the chat so everybody can click right to it. But it has everything from sample diagnosis letters, sample templates for 504 plans, all of the recommendations, how to find out if your school receives federal funding, if your child goes to a private school. So lots of great information. We also have a live monthly session that we run in conjunction with Boston Children's Hospital and about a dozen other hospital centers where you can come and ask your questions live to us. And we help work through various challenges that come up, as well as give lots of suggestions for managing celiac at school. And so I'm going to pause here and have Megan come on and touch on the nutrition piece just a little bit more.
All right, thank you. We have a lot of good questions in the chat, so I will keep this brief. But we wanted to talk a little bit about what conversations you might have in terms of nutrition as you're setting up these plans for your child. So just to be aware that the meal pattern for schools does have to follow certain guidelines. It requires that foods get grouped into these components, which are based on the food groups that the foods are in, and that the portion sizes are dictated by the grade that the student is in. So they are age specific. And the goal really is to meet USDA nutrient standards. So this is an example from the USDA website just showing kind of their version of a school lunch that is balanced. It follows the plate method. If anyone has seen the My Plate USDA graphic, that is the basic model. So it includes vegetables, it includes grains, it includes milk, it includes fruit, and it includes some sort of protein. So Vanessa, if you want to go to the next slide, this is like a different version of that chart looking at the key components. Basically, like I said, the components follow the USDA plate method for balanced meals, and each meal needs to include all of these components. And the portion sizes, again, vary depending on the student's age. When it comes to fruits and vegetables, there's a few things to keep in mind. The smallest serving that a portion is allowed to be is about an eighth of a cup, but more is always allowed when it comes to vegetables. The creditable amount depends a little bit on the form that the food is in. So it could be cooked, dried, raw. That determines the appropriate portion size. But no more than half of the fruit or vegetables offered can be juice. So we do need to have some whole forms of these foods. Quickly on grains, at least 80% of the grains each week must be considered whole grain, which obviously becomes a challenge for someone with celiac disease, which is really, again, to drive home the point of why the 504 plan is so important. Students with a 504 plan are able to receive gluten-free substitutes for these grain-based products, and it is sometimes that's something that you need to do a little bit of educating with your school about. They don't necessarily understand that the 504 accommodation plan allows for that substitution. So just one more thing on this part, there are some additional dietary guidelines that are coming up. Starting in 2027, schools must comply with limits set on added sugars. And this is very important as we start to try to transition people's thinking as to what is considered healthy. So the USDA and the FDA actually do have a set standard for those terms, and we want to make sure that we're limiting added sugars and sodium to an extent in the school lunches. So you can go to the next slide, Vanessa. This is actually a slide that Vanessa has used many times, and I love to share it because it shows just some practical ways you can accommodate a gluten-free diet. We actually covered a lot of these in Vanessa's presentation, but just if you go through the guidelines document that Vanessa shared the link to, or you're trying to give your school some practical ways they can make these accommodations easily, these are some ideas that we found work really well. So every school is different. They're going to have different policies and procedures and options available, but these are some options that a lot of schools can do. So with that, I will ask that the speakers all come back on camera. And also we have Francie Kelly and Sharon Weston here from Boston Children's Hospital, and they are experts as well. So if you feel free to jump in if there's a question you'd like to answer. So we will start with, if a school refuses to supply a hot lunch but is willing to supply a cold lunch that is gluten-free, is that considered reasonable? Last year, my daughter was able to get hot meals, but this year they told me that they could only provide cold meals because of staffing. I'm wondering what is reasonable.
That's a really good question. So we like to see a hot meal for a hot meal. However, the requirement is that it's a nutritionally equivalent meal. And so they have to meet the food groups that are required by law. So like the plate that Megan showed, they have to have a protein, they have to have fresh fruits and vegetables, they have to have a grain, and they have to have milk. And so that doesn't necessarily specify that it has to be hot, but you could argue that other students have access to a hot meal, and so a child with celiac disease should have access to a hot meal. Though I will tell you, it will likely come down to them meeting the nutritional requirements of what needs to be on the plate. Though cold grains are not always that easy to meet if it's outside of like a sandwich. So,
Yeah, thank you.
Francie, would you add anything to that or?
No, I was just going to say that it would be better to have a hot meal option, but again, as long as they're meeting the nutrition requirements, that's what the law says. So that's what you can insist upon.
All right, there's a really interesting question in the Q&A that I think maybe requires multiple angles. So I'm wondering if you can speak to how cross-contamination is managed practically in schools. This has been a barrier at our school because food is ordered and not made in-house. Parents disagree about whether certain vendors are careful enough with cross-contamination. What is your advice there?
I can start. So I think that we have to go to, what is reasonably expected in order to cook a safe meal. And so obviously good cleaning procedures, creating or preparing the gluten-free meals first. Most schools that we work with actually prepare all the gluten-free meals first, set them aside in wrapped containers or however they separate them, and then prepare the gluten-containing meals. That's probably the most common thing that we see. Um, but I think it really varies by school. Some schools purchase like the bake in a bag type products so that there is no risk of cross contact, and the students actually open the meals themselves. They're not actually opened by the food service provider. But I think that there are lots of different ways to do it, and not like a minimum standard beyond, normal cleaning procedures that happen, but they're like really looking at how your school cafeteria operates and how they can modify what they're doing to make a safe meal for your child.
I'd also jump in and say that you need to find out from the school what they're doing and not rely on what other parents are saying. Because something that they did 3 years ago that they're no longer doing in the cafeteria could be what some parent who has an older child is telling you is what's going on in the cafeteria. So make sure that you're getting that information from the school. Vanessa in her slides showed a great link in terms of what Nita Mess is doing, in terms of like explicitly putting out on their website, this is what we're doing. I know lots of parents who have requested a tour of the cafeteria so that they can, see how the cafeteria, the back end is laid out. Of course, this does not happen during mealtime because they are very, very busy. So be sure that you are respectful when you ask for that. But just see how things are laid out, and they and ask questions at that point in time about what they're doing. But find out what's really happening. Don't just rely on sort of the rumor mill.
There's another question sort of related to cross contact. Can you address how to handle gluten-free labeling that might not be gluten-free due to oats, particularly with Lucky Charms and Cheerios? I'm having a hard time with our school explaining labeling around gluten-free. So I can start. So oats are tricky. We have to kind of use the FDA standard as our standard for gluten-free. So with oats, my advice is if the product is, you need to look for an oat product that is labeled gluten-free. If it has gluten-free anywhere on the packaging, then it does have to meet the legal requirements for gluten-free, and they are liable for that label. So with oats, as long as it says gluten-free, most people will tolerate them well. There are some people who don't tolerate oats well, but that has to be an individual decision based on a conversation with your dietitian and your doctor.
Yeah, and I'll just add that we know that there are a subset of patients with celiac disease who react to gluten-free oats. Even if they are, labeled, certified, all of the testing done, they still react to oats. If that is your child, it's important to work with your physician that in your diagnosis letter, they write that they need a gluten-free and oat-free diet, and that will require the school to make accommodations that would not include oats.
Okay, I think we have time for one more question. My child attends the largest school district in the US, New York City, and getting that giant district to attend 1% of its students, attend to 1% of its students feels quite daunting. Are there examples of large school districts taking this on?
Yeah, absolutely. So in Massachusetts, Framingham is the largest school district. And for Celiac Strong Day last year, which if you haven't signed up, I'll actually put Emma on the spot in a minute and have her explain that. Their entire school district went gluten-free for the day to raise awareness of celiac disease. They're not quite at the level of New York City, but they are a very, very large school district in Massachusetts, and it is absolutely possible. Sorry, Emma was not prepared for this, and I totally just called her on the spot, but this is a great opportunity to share.
No, no worries at all. I'm very happy to share. I'll drop the link in the chat in just a second. But coming up, we just opened signups for Celiac Strong Day, which is going to be May 16th during Celiac Awareness Month on International Celiac Disease Awareness Day. And it basically, um, in recognition of celiac disease awareness, the Celiac Disease Foundation we put together a bunch of resources to help empower students to educate and spread awareness about celiac disease in their schools and communities. So we made a bunch of educational resources, tools for setting up your own Celiac Strong Day in your own classroom and school. We even have partnerships with some gluten-free brands to provide gluten-free snacks for you to share with your classmates. And it's a really great day, really fun, and just a way to really make it an inclusive and empowering environment for these kids. So I will go ahead and drop that in the chat right now. And there's all the information on that page that you'll need, and we hope some of you sign up.
It's a
Right.
really fun day and a great way to get your kids involved in raising awareness.
Thank you. All right, so that is all the time we have for today. Thank you to our speakers and our expert panelists for joining us. Just so everyone knows, we have monthly school support sessions hosted by Francie Kelly, who is here. And for a lot of these questions about developing 504 plans that we were unable to get to, I really encourage you to join one of those because we cover all of this in that monthly presentation. So I believe the link is in the chat, but you can also Google Celiac Disease Foundation School Support Sessions and you will find all of the information that you need. So